In adults, the most common cause of choking is food.
Choking can occur when a solid object, such as a piece of food or a small object, enters a narrowed part of the airway and becomes stuck. On inhalation, the object can be drawn tighter into the airway and block air from entering the lungs. A forceful thrust beneath the ribs and up into the diaphragm can pressurize the air in the chest and pop an obstruction out of the airway. Compression of the chest over the breastbone can also create enough pressure to expel an object.
Let's learn how to help a conscious and unconscious patient expel an object that's causing him to choke. If you believe a person is choking, begin with scene assessment. Stop, think, and act. Since you're not likely to have contact with body fluids and time is important, you usually do not need personal protective barriers. Ask a responsive patient,
"Are you choking?"
If the patient is coughing, wheezing, or can speak, encourage the patient to cough until he expels the object. If the patient cannot speak or breathe, give the responder statement and alert emergency medical services.
Emergency responder, may I help you? All right, take it easy.
After the patient indicates he wants your help, a nod will do. You may use back blows, abdominal thrusts, or chest thrusts to attempt to dislodge the object. To deliver back blows, take a position to the side and slightly behind the patient. Supporting the chest with one hand, lean the patient forward. Next, firmly strike the person between the shoulder blades with the heel of the other hand 5 times. Stop if the obstruction clears or move on to another technique. Abdominal thrusts use residual air in the patient's lungs to blow the obstruction clear. Stand behind the patient with your arms around her waist. Find the patient's navel with one hand. Make the other into a fist and place the thumb side against the patient's abdomen slightly above her navel, like this. Put your other hand on top of your fist. Bowing your arms so you don't squeeze the patient's ribs, pull your hands inward and upward in a thrusting motion. Stop if the obstruction clears or move on to another technique. Abdominal thrusts may not be possible with some individuals, such as those who are pregnant or markedly obese. In these cases, provide thrusts in the center of the chest.
Are you choking?
Use your fist with the thumb inward and the other hand on top, just as you do with abdominal thrusts, but put your fist on the same site where you would perform a CPR compression. Continue using one or more of these techniques until the obstruction is relieved or the patient becomes unconscious.